So if the restrictions are not eased after Friday, what's your view? Should school go back next week?
Well, good morning, Peter. It's good to be with you. What we would like to see is that the same restrictions that apply across the public within local government areas apply within schools as well. The most important thing with respect to this pandemic, and we learnt this last year and it's certainly true now, is that we need clarity and we need consistency with respect to measures and the application of those measures. The Delta variant is causing significant concern for teachers, it's causing concern for parents and the general public alike. What we know now is that there's been some 37 cases of young people aged 10 to 19, a further 25 cases of children under 10, which demonstrates the impact and the potential impact of this Delta variant. Children can contract the virus and can also transmit the virus, and therefore the health and safety of all members of our school communities must come first.
So should children get vaccinated? Should there be a priority on that?
You know, Peter, we're very careful not to cross the line with respect to medical advice. We note that there is a discussion happening amongst the medical fraternity right now in Australia with respect to vaccinating children 12 years and above. We know that's the case in a number of other countries. The US is reporting vaccinations of younger children. We await the medical advice, and as always, we will act consistent with that medical advice. The most important thing is that we act consistently with that advice, and we have the medical findings applied consistently across all settings.
Yeah, well, I mean, the game has changed, isn't it? Hasn't it, with this Delta variant 12 months ago? I mean, the Prime Minister had said that the schools are safe, but things have changed. Kids are getting, as you said, they're transmitting it too. So doesn't that stand to reason that perhaps, you know, that kids should be vaccinated? Do you have a personal preference on that? I know you're looking at the medical advice at the moment. You want to wait for that, but do you have a personal view on it?
Our focus at the moment is to ensure that teachers are prioritised, Peter.
Yeah.
We started making representations in August of last year. Indeed, in February of this year, the State Minister, Minister Mitchell, echoed those representations about prioritising teachers. Of course, we all thought and we were told we'd be vaccinated by the end of March, but now we're living within this environment, a monumental failure with respect to the vaccination rollout. Noting the Delta variant, noting that it can be contracted by kids and transmitted by kids, it's critically important that teachers are prioritised. 47% of teachers are under the age of 40. Some 72% of teachers are under the age of 50. Without prioritisation, we will not see the vaccination rates increase at the level they need to be amongst the teaching service. We're getting reports of teachers in the last week or so trying to book in to get vaccinated, and they're being told that they need to wait until September and later than that as well. We recognise there are other members of the community that should always also be prioritised. There's no question about aged care workers. There's no questions about those who are involved in the quarantine systems. But teachers, given the importance of schools, given the importance and the evidence around the Delta variant and the spread of it amongst kids, teachers must be prioritised.
So there's some 88,000 teachers in New South Wales, 123 staff in total. At what level do you think they have been vaccinated?
We don't have those figures, Peter, unfortunately, but we'd expect it's at the similar level to all members of the community. As I said, 47% are under 40. They would not have been vaccinated. We've got 72% under 50. The numbers there would be low as well. Teachers have not been prioritised, and that's why we need to move now. In fact, we should have moved yesterday with respect to this prioritisation.
Angelo, Gavrielatos, appreciate your time this morning. We'll talk to you soon.
Thanks, Peter.